following is a conversation. It has the features of any conversation, such as imperfectly expressed thoughts, ill-considered opinions, and the notions of several sleep-deprived brains. Try not to get your stethoscope in a twist about it.
On today's show, we're checking the vibes. Checking the vibes of medical school and other things that medical students do with a little game. But first, I want to know how... So we've got a new crop of M1s in here today, and Jeff. As usual.
Woohoo.
And this old fogey over here as well.
This old fart. And I want to know how you guys are doing. I want to know how you guys are doing.
We're surviving.
Hey, that test is over, though.
That test is over, and I'm really hoping that it was like the peak, and now we're on the downhill slide for the rest of the semester. I mean, it's not going to be. It's going to be more of like a trip, fall down the mountain, but we're going down instead of up.
I was realizing there's
4
not
weeks
a lot
of tripping.
That's
I
really
was realizing there's not a lot of
Yeah.
time left in the semester.
It's quick.
Which to me is a huge problem because I have things to do that I haven't been doing, so I better get going.
Same. It gets
Same.
better from here.
I'm hoping.
Yeah, it's all uphill from here.
Uphill.
I feel like that's what they all say.
Wait, uphill is bad.
We want uphill.
No, uphill is good.
No.
When you say
Oh, no,
things are
I
going
would-
downhill, that's
Oh,
a bad
Okay,
thing. You don't want to
yeah.
go downhill. You want to go uphill.
Yeah,
Okay.
but when you're talking
I'm
about the
thinking
effort that
effort.
you
Yeah, the
want
effort.
I'm not saying it's going to be effortful. I'm just saying the view is going to be better.
Oh, good.
Okay.
Good. Okay.
Wow.
Well, you got to work for
I'm
a
ready
good
for a
view.
better view.
Yeah.
Mhm.
Meandering in the margins of medicine, it's the Shortcoat Podcast.
Weird news,
Fresh views
helpful clues, and interviews.
by students for students.
Subscribe to our weekly show at theshortcoat.com.
Welcome back to the Short Code Podcast. This is a show that gives you an inside look at medical school from the students drinking from that fire hose. It happens to be a production of the University of Iowa Carver College of Medicine. And I happen to be Dave Etler, but that is not important right now. With me today in the SCP studio, we've got Jeff Goddard, who's an M4.
I mean, I guess, yeah.
An M3.
Yeah, that sounds better.
An M3.
Close enough.
It's almost, you're a couple of months away from an M4.
I
Don't
don't really do the math, honestly. I'm
Don't
just
get all up.
showing up.
We've also got Kim Fairhead, who's an M1.
Hi.
We've got Gabbi Bullard, who's an M1.
Yep.
And we've got Annie Dotzler,
Hello.
who's an M1.
Actually, Gabby and Annie are PA ones.
We weren't going to say anything.
No, you have to say these
I knew
things.
they weren't going to. I
proud.
knew they
We're
weren't
loud
going
and
to correct
proud
you.
PAs.
We
I
are.
knew
We
that
are
they were
loud and
not
proud
gonna correct you.
PAs. But we
Yeah.
also wear short coats, so we figured it was okay.
No, it's totally fine. I don't know. I did this last week because I also had problems last week preparing for the show. This week I had problems preparing for the show. If it's a little janky, if it's a little crazy.
Makes it better.
Didn't you just do a book club last week?
Yeah.
Yeah, they show up with a book.
No, I mean,
That was the whole show.
their preparation was fantastic.
Oh, okay.
My preparation was shit.
Okay, it's you. Okay, you're the problem. Got it.
Yeah. Anyway, I try. I really do. Anyway, welcome to the show. Glad to see you. Let's just get into the activity that I did plan today, which was a game. And the game, I saw this game on YouTube and I was like, well, we got to try this. So I vibe coded an app while I was doing other things this week. I vibe coded an app that will help us, I hope, to do this game.
What does vibe code mean?
So in the
really
age
technical.
of artificial intelligence, now you can say to an AI, hey, make an app for me. I want it to do this, that, and the other thing. And it will try to do that. It will do that. And this is the first time I tried doing that. And I was in many ways successful. It was kind of a surprising turn of events.
Better than I could have done. That's for sure. One of my favorite things about AI is that it's like 40% competent compared to like somebody who's actually competent, but compared to somebody who's not competent at all, it's killer.
You know what? I've said this before, but I feel like AI is, we're all just crappy LLMs, crappy large language models.
Yeah.
You know, sort of fumbling around,
valid.
Yeah.
right? I mean, you know, like
Some days extra crappy.
people are always like, you shouldn't trust what AI says because it might be wrong. I'm like, look around us.
Mm-hmm.
We're surrounded by, like maybe we're trained specially on like, say, medicine or podcasting
Not yet.
or whatever. And you can be like, oh yeah, I have some knowledge of that and I'm going to help you, give you that knowledge. But most of us are just like
Can I give an example?
around.
Because it just makes me laugh every time.
Yeah.
So, before the internet, which none of you are old enough to remember, that's okay. The internet wasn't always there. I'm just going to rip that Band-Aid off. Yeah. You'd have that crazy weird uncle who would say something at family dinner and you'd be like, oh, I guess I can't refute that. Like, I don't know enough. Encyclopedias are really heavy. My arms are small, I didn't have a chance. Right. And then the internet came along and all of a sudden I could look it up. I'm like, oh, that doesn't sound right, but we'll check it out. Right. And then you look it up and it's like one of the examples, Easter just happened, right? So there's this meme going around for a decade or two that Easter was based off of Ishtar, which is like a Mesopotamian god, which is not true at all, right? It's a Germanic. Anyway, it's not the point. The point is, it was totally made up. They're like, oh, these two words sound the same, so they must be from this. That's not how this works.
Yeah.
I was like, oh, okay, I can look this up. And I looked it up and I was like, turns out it's not true, right? And then you tell somebody that and they're like, I don't care. I'm still going to share it, right? And then they do. And like the next year they're sharing it again. I'm like,
it's all, we're all just...
We are the hallucinating AIs. It's us.
Stringing together words that make sense to us. But
our intelligence is also artificial.
I'm a firm believer in this. And I know people who disagree with me vehemently, but I'm like, no, we're all just AI layered on top of some sort of idea that we have control over things in our lives and that and that we can do things about other things.
So free will's out the window.
Free will is absolutely out the window.
We're getting existential.
Yeah,
Yep.
we're getting philosophical.
Yeah.
I'm here for it, though.
Yeah. Anyway, that was a tangent.
Quite an intro.
Love that.
Mm-hmm.
So we're going to play this game. We're going to see how it goes. But before we do, shortcoats, if you hear something that causes an emotion of some sort, makes you feel a thing, gives you an idea, let us know. Visit theshortcoat.com/tell us. Give us a piece of your mind so that we can make the show about what you want to talk about and not just me.
Since this does go out to an audience, I just have to push back a little bit. Free will is a real thing, audience. You can fight between if you agree with me or Dave, but somebody has to say the counterfactual on that one. Go ahead, Dave.
Oh, man. You can't.
That is a can of worms.
Can you justify your position? I can't justify my position.
See, this is my point with the whole hallucination thing, right? Like, you go one layer back and you're like, I don't know.
I'm just spouting.
I just made it up.
Again, I'm just spouting things that I've heard from scientists who are like, the brain makes decisions before you're even aware of them. So how much free will do you actually have?
Yeah. So there's essentially... there are like obviously several camps in this, right? But one of the big philosophical ideas is this reductionism, this idea that you are essentially the sum of your parts, right?
Right.
Which
you are a physical being beholden to the laws of the physical world.
Yeah. And I would push back and say that almost anybody, especially in medicine, doesn't actually believe that we're just the sum of our parts, right? We are the sum is greater than the parts themselves, right? But the argument, there's a really good book, and I'll find it later and you can drop it back in here. But there's this really good book that talks about, he goes through basically the evolution of life and the idea that, there's a point where we're just responding to external stimuli, right? Mm-hmm. Like a cell notices sodium and reacts to that sodium via receptors on its membrane, right?
It's a very med student thing to say.
Yeah. But you get to a point when we are not just responding to stimuli, right? Mm-hmm. And I think the best argument for this is metacognition, the ability to think about how you are thinking, right? If I can say, today I don't want to respond to the same way to that stimuli, all of a sudden we're introducing more into the process, right? And obviously people have given lectures, they've written, the book I'm talking about is like, 1,000 pages. Like, people get really into this stuff and there's arguments to be made for both sides, but I think it really comes down to vibes. Like, how do you feel about it?
Yeah.
I think important for the audience is there's enough evidence both ways that you get to pick which one you pick, and that's fine. And there's no actual answer to this question. So
there's no downside either way.
Yeah.
You're going to do what you're going to do.
Yeah. This isn't like that Ishtar thing. Like there is actually no answer here because we can't figure it out.
Because we can't figure it out.
Yeah.
So there you go.
Ask ChatGPT.
I am
don't
not
know.
able to defend my position, except that I've heard some people say that free will is bullshit. So, okay. So this game that we're gonna play, it's called. I'm calling it Vibey, mostly because the game that I ripped it off from is probably copyrighted.
Smart guy.
So this game, I've left you some pages there with some topics, and there's one for each of you. You can grab one. So we've got topics on one side, we've got vibes on the other side. The vibe master's job is to pick a topic and 2 vibes, and then they will come around the counter here and give me those. Well,
Out
so
on
you
the
have to pick
spectrum?
where it's at in this grid.
Okay.
Oh, okay.
So, for instance, you've got the topic here is meal prep. The vibes are tailored fit to itchy tag and dissociated to 2 involved. So you sort of pick in here where you think either you or it could be most people would see this topic, and then the other people will sort of discuss and try to figure out where he put his choice. For instance, if Jeff was playing. Does that make any sense?
Yeah.
I
see
could
what
have
you're
put that
saying.
a lot
It's
better.
like that. There's like a color game where
Yeah.
you like give clues
Yes.
on
Yes,
color.
that's what I was thinking
yeah.
about. I have it. I forget the name of it though.
Yeah. We should play that sometime. I want to
What is
try
it
it.
called? It's like a
Mm-hmm. Oh, yes.
Oh, there's that one
I didn't know
too.
you guys were
That one's
talking about.
fun.
I've seen that one too.
That one's fun.
My in-laws tried to play that with me, but they like
You'd
had
be
no
a pain in the ass.
concept of who I am as a person, right? So they're like,
it does like cause a lot of
Turmoil.
like playing that at a family holiday, as I have done.
Stressful.
you just got to remind the
little bit
family. Like,
polarizing.
I'm not saying this is the objective answer. I'm just saying these are my vibes.
What the
This
heck
is
is
how
it
I
called? Why can't I think of it?
I can't think of
feel. I
it.
don't know.
know
I
it.
blocked it out. It was too
I know
traumatic.
it too. I can't.
Too traumatic. Flashbulb memories going off right
Yeah.
now.
Let's do a practice round. Who wants to go first? That's not Jeff.
I think Gabby. She just seems like a natural born leader, you know?
All right.
I would agree with that.
Yeah.
Yeah,
assumption.
let's do it,
Yeah.
Gabby.
Gabby, tell me your topic, and we can do custom ones too. We don't have to choose from these, but let's do practice round with one of the.
In light of the Oxkey being next week, let's do reflex hammer.
What vibes would you choose?
We're gonna do chaos to composure, and loudly wrong or quietly right.
Come on around here, and we can pick your.
Annie, where are you from?
I'm from Wisconsin.
Wisconsin?
Yeah, small town Wisconsin, but I've been here for 5 years. I went undergrad here, so
Okay.
It's not that small town, is it?
I mean, no.
Is
but
there a
I'm-
big
it's like
town in Wisconsin?
It's near Madison.
near Madison, but comparatively, it's small.
people say they're from Chicago? Yeah, it's kind of the same thing.
Yeah.
She's like 42 miles away. No, she's not actually, but
No, you're like 10 minutes. What from
20.
Madison, right? Okay, yeah.
Yeah. It's like a small farm town.
I'm just going to say Madison suburbs.
Yeah.
That's
Do you live in
Yeah,
a cul-de-sac? Do you live in like a suburb?
Yes.
Yeah, that's
Suburbs.
suburbs.
don't
Yeah.
say farm town and
That's
then
not a farm
put
town.
call the
It's
town.
Farm towns don't get to
Yeah,
have
there's no
suburbs.
cul-de-sac.
I have
That's
never-
my
my
best friend from
I have
home lives on
literally
a dairy farm.
Never heard you describe this. I've known Annie since junior year of college, and I've never once heard you describe your hometown as a farm town.
Have you ever heard me introduce myself to someone?
No.
Yeah. You
People
guys.
from Wanakee say it's a farm town.
Or yeah, but you're like, yeah, I'm from Wanakee.
How many people did you go to high school with?
More like wannabe
300.
farm town.
Literally.
Wannabe. All right, now that Annie's off blast.
Sorry, Annie.
That's okay. Okay. Shout out Wanakee.
All right. So Annie has made her choice. Now you guys get to discuss,
Can I preface?
preface away.
Oh, are
Okay.
we supposed to be able to see the choice?
No, we have to
No.
guess
You're supposed
now.
to guess the
Now you have
choice
to
where
guess.
I put the choice.
Oh, okay, we're talking about reflex.
This is specifically trying to get the correct elicitation of a reflex on the first try.
Okay, that's good
Okay.
to know. So we've got reflex hammer is the topic. We've got quietly right and loudly wrong on one axis, and then we've got chaos and composure on the other axis.
So am I understanding this right? In your mind, you're saying this is how it is to use a reflex.
Yes.
hammer. Like-
This is how it is to attempt to elicit a deep tendon reflex on the
first time.
first attempt
I'm
in
gonna
an
go
OSCE
with-
when you're stressed out.
I don't think that she's got negative numbers on the x-axis, but I'm pretty sure they're pretty small. So I'm going pretty far that way. I don't know about
Towards
the up
chaos?
and downs. Yeah. all the way down towards the low.
We're
note.
talking chaos.
Yeah. She
talking
wouldn't have
reflex
picked this
hammer,
topic
too.
if she felt that she was composed with that reflex hammer.
But
That's how I feel. I don't know.
arguably, yes, it is. But it's also not chaotic because you're in the OSCE, so you have to like keep it together, right? Like you're not like swinging the reflex hammer around, like running around the room.
Yeah, but we all know that's a facade. Like,
or maybe
I do
it's,
some
like,
wild
fake
stuff in
composure.
an OSCE.
I agree. I think it's more towards chaos,
Okay.
but I don't think it's like zero.
I think since it's OSCE, we're more right than we are wrong. So it's a little chaotic, but we're more right because we're being tested.
Like you're doing it correctly.
Yes, but like it's still feeling chaotic. So I think towards 0 on the x-axis, but towards the top on the y.
I disagree with that.
I would put it like strong middle on the y-axis. Personally, I don't know.
Yeah.
Because we're talking about how you feel about it,
Yeah.
not necessarily how you're going to be.
I mean, I don't think
able
that
to
she's
do it.
walking into the OSCE loudly wrong, just smacking him on the forehead with it. Like,
Okay,
oh,
true.
where's that
Yes.
reflex?
Agreed.
You know,
Agreed.
You're supposed to kick your leg.
There might be points off if you do it that way.
So funny. Just
Give me a
clunk.
twitch.
Your leg's not kicking.
Nothing.
The standardized patient's
You
like,
must
I
have-
literally have no box to check for this.
You must have lower motor neuron disease.
So I don't think she's there. Okay. I don't know. I haven't seen you in an OSCE. I don't know if you guys have studied OSCEs together.
I don't think we have.
Mm-mm.
So
the
there are
order of
various
these things.
places that you hit people on their bodies with the reflex hammer. Like the knee is the famous one that I always think of. There's an ankle one.
Tricep,
Tricep.
forearm,
The
radial,
radial
radialis.
or whatever
And-
it is.
and-
Basically,
are you
look for a
just-
joint and smack it.
Right. And
Yeah.
are you
See?
and are you that's what she said. And are you And are you aiming in this OSCE? Do you think you'll be going for all of them, or is it just
We
gonna
gotta
be
go
We have
for
to
all
go
of
for
them.
certain them. Yeah, we have
You
to
got to
go.
hit them all.
So there's multiple.
Okay, that sounds pretty rough, actually, because I feel like I could do a knee reflex pretty good. I feel like I know where that is because I've done it on myself, and I feel like
the tricep one's hard because like so they have to be relaxed, right? So that you can get the reflex, but you have to also hold their arm up so you can get to the tricep tendon, and then with the other hand you have to whack it. So it's like I feel like it's
a lot of
internally chaotic,
contradictory
like you're like,
things involved.
Yeah.
Yes.
Yeah.
but you're trying to look composed, but I don't feel composed.
I wouldn't
in that.
call this a pro tip because I don't get paid to do any of this. In fact, I pay a lot of money to do a lot of this. But in order to do it well,
Yeah.
you wiggle their arm a lot while you're talking to them before you hit it, because that like they're not thinking about their arm. They're not
They're loosened.
and then give them a whack before they're able to think about what's going on with their arm. Talk to them about the weather. Talk to them about Wisconsin. I don't know, whatever you do.
Tips from
Okay, that's helpful.
tips from an M3 right there.
Yeah, thank you.
Oh yes.
We'll take it.
Much needed.
Mhm.
Always
So what are we
enabled.
thinking about? Like somewhere around here?
I mean, that's my ballpark. I don't know.
I don't know.
I like that box right there.
How
I
do
would
we
be happy
feel
with
about
that.
this box?
One right above it, I think.
How do
I
we
would feel
about this
happy with
box?
that box.
What about you guys?
Yeah, I'm cool with that.
I think a little bit higher up on the y-axis, but we'll
Okay.
just go there.
I mean,
Go
I
to
trust
where-
you. You
We'll
guys
go.
know each other. Your names rhyme. Like I just got here.
Do they?
No.
Our names don't rhyme.
They end in E. That's close enough for me.
Annie and Abby do not rhyme.
Okay.
So we're talking about right here. So basically, we're in the middle of the quietly right, loudly wrong axis, and we're on the getting towards the extreme end of chaos versus composure. We're on the chaos side.
I think that's fair.
All right. All right, here we go. I'm hitting the button. Come on. Oh, shit.
Did we get it?
It didn't work.
Oh.
So I think you chose
That one.
that
Yeah.
one right
Oh,
here.
close.
We're close.
Yeah.
Yeah,
Okay.
I'm like loudly wrong because it's obvious that like no reflex is ever happening. Like I hit and I think I'm in the right spot and I'm like, oh,
Right.
Nothing.
Yeah.
Yeah.
So
Literally
you're being
nothing.
you're pretending competence.
yes,
And it turns out
internal chaos. Yeah.
But you know what's so weird is like for the OSCE, like they don't even have to elicit the reflex for us to get the point.
That's what I'm saying.
You just have to hit it in the right area.
hacks.
Oh, I forgot how it
Which
works.
is odd.
I had to click submit. Yeah. Well, you got a point there for whatever that's worth.
Okay.
Perfect.
Wow.
You were like
Ooh,
three
rock.
to
Oh, I guess I
three
had
away.
one
That's
lower.
not bad. That's not bad.
Really not. You're very confident.
If it helps when you get on your neuro rotations, they'll give you a better hammer and they'll laugh at you for using a bad hammer. But then when you're on any other rotation, they're like, "What are you talking about, hammer? I've got a stethoscope."
Yeah.
Yeah, you're gonna
Right.
use the edge of your stethoscope. What's the better hammer?
It's just heavier.
Oh,
So you get more leverage.
yeah. So you can really give them
The neuro gods.
a good whack in the forehead.
Yeah.
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 What is it, that forehead deep tendon?
It's where their forehead goes. All right. Well, that was pretty good. Not bad.
Nice job, Gabby.
Do we want
Thanks.
to?
Hopefully the Oski goes better.
Who
Right.
wants to do the next one?
I think the person whose names rhymes with Gabby, I think,
Allegedly.
allegedly.
I think Kim should go.
I'm gonna be a doctor, but it's not in English literature. Let's be honest.
I've decided.
What do you got?
We're going to do studying an hour before the exam.
Okay.
Love it.
Us this morning.
Oops.
Me every day of my life.
Okay.
Oh.
You
I mean,
just gave
they're
it
gonna be
away.
guessing in a second.
Well, I do
anyway.
that every time, Kim, anyway, so it's okay.
And then what?
Hot mess spreadsheet,
And
vibes-based, evidence-based.
all right, you got to come around. All right. So on our grid,
love
the
this.
topic is studying an hour before the exam. On the left axis, we have evidence-based to vibes-based, and we have hot mess to spreadsheet.
This is interesting. I could go a lot of ways with this.
Did you go to Iowa for undergrad?
Don't
Yeah.
Don't look at the screen.
Did all three of you become friends in undergrad? Is that?
No, I
these two?
didn't know them in undergrad, but Annie and I have a mutual friend who I used to play like volleyball and softball with, like in middle school.
Cute.
And she's one of my like best friends from college. But we all know very similar people.
Yeah.
Yeah. Kim and I were in the same undergrad program here, and we studied together in undergrad.
Yeah.
So we're now
Yeah.
still study buddies.
Now you guys can discuss where you think Kim put the put her selection.
I think that anybody that's come this far in education understands that it's vibe space.
Yes. At
Oh,
least
yeah.
me personally.
Yeah.
It's vibes only.
What's vibes based?
Studying an hour before the exam.
Yeah.
I think it's not really helping you, but it makes you feel good.
I think
Nothing wrong with that.
yeah, I think one of my biggest complaints about exams on Fridays is that some people don't want to be on the podcast because they're like, I have to study, and I keep thinking it's not gonna
It's
help.
always after, though. Like, we're done. We
It's
already took
usually
it.
after,
Yeah.
but sometimes they do exams in the afternoon.
Yeah, I think you'll find in the fall a lot of your Friday exams will fall at 1 p.m.
Which is
Is
super
there like
annoying.
17 lectures that morning too?
Yeah.
No.
Oh, good. I feel like I could go two ways on this because it's either completely vibes based and I'm like scrolling to a random page in my study guide and like absorbing whatever I can from it, or it's like other people are talking about what they studied. And so it's like very evidence based of like, oh, that's good, I should look at that. Or, oh, I remember he said that, so I should look at that. So I could go either way, but for me personally, it's totally
what's
vibes.
bonkers to me?
What?
That like there's maybe 2 kids in your whole class that get 100% on all the exams, right?
Good
But-
for them.
You think it's the
Achievers.
same people?
I think it
there
is.
was a kid in my class who missed one exam question.
The whole
Our first year.
semester?
What?
Oh,
my
the
God.
year?
Yeah, he was really mad about it too.
Oh, he
Um,
should be. Boo
Poor guy.
I'm sorry.
Right?
The empathy over here. Out of control.
The rest
We're
of
a
us,
pass-fail
the
program.
normal-
I don't know if people know that, but he's fine.
Well, I mean, he got a nice scholarship out of it, so
Yeah.
they paid him to do it, right? But I brought this up because it's crazy to me that we all miss questions, but the majority of us get each question right.
Yeah.
So like we're not
Right.
all missing the same question. And
Okay.
it's so I don't know. I still think it's bonkers that like
It's like
you can actually trust the consensus on all of these questions. If you put like all medical students in the country in a room, they could probably diagnose the patient based
would
on
hope.
consensus.
that would be very
Yeah, that would be-
inconvenient. But you know.
How many med students can fit in a room? Is that?
Yeah. Okay, so we've got vibes based. It
Such
seems.
a tangent. I'm so sorry.
Oh, don't apologize to me.
Yeah, apologize to me.
we're here for the vibes, Jeff.
Yeah.
It's perfect.
I will say, so me and Kim studied together before the exam. Well, we studied together for exams most of the time.
Mhm.
But on
And
the
you
day
leave
of,
Kim out because Kim's like a bitch.
no, me and Kim study together.
Oh, I thought you said so. You leave.
I'm out.
You leave
Yeah.
Gabby out.
I'm
But
cooked.
it's not anything against Gabby. We didn't know Gabby when we started studying together in
Yeah.
undergrad.
I'm not
But now-
lonely though.
But now things are fixed.
We're
I have my
long-term
own study
Yeah,
buddy.
Sorry about it.
Okay.
Yeah, shout out
I
Kennedy.
don't think she wants
Shout
to
out
be. I don't
Kennedy.
think- yeah, I was gonna say. I I think
Kennedy
she's
and
good.
I are attached at the hip.
Mhm.
So
Okay.
So anyway, Kim and I study for
Yeah.
our 10 a.m. exams. We come to Java House promptly at 8 a.m. before the
promptly.
Oh, okay. Sorry.
So we have 2 hours of studying, and normally on Thursday night we figure out the vibes of what things we want to talk about. So I think that we're pretty spreadsheet with when we meet, but we're vibes based with how we talk about things because we literally just spew random information into each other's faces. We just talk to each other for 2 hours straight before the
Okay.
exam. So I think if we're going
So
based
it's really
on how
like
we study,
socializing, but about the exam that you're about.
yes,
to
we
You
just
know,
converse about
Yeah.
random
Dr.
things that we can remember.
Sipla does say that that's the best way that humans learn.
I have him on video saying that, so
Yeah.
he definitely believes it.
You get hooked because then randomly she'll say something and I'll be like, oh, whatever, that's not important because I say that in my head because I don't know it.
Mhm.
And then we'll get to the exam and then I get that
It's
question
always
right
there.
because I'm like, oh my God.
She just said this
Annie
at
just
Java
said that
20
word.
minutes ago.
I have no idea what it was about, but she said that word and I'm going to click that answer and then it's right.
So yeah, for all of the prospective
America.
Yeah. How to study in
all of
med
the
school.
prospective medical students, PA students, any healthcare education, word association is your friend.
Yeah.
Get used to it now.
I do have to say that. So I'm on the far side of clinicals at this point, right? And I've taken one of the 2 board exams, and I'm studying for the other board exam, and I did them in the wrong order, but that's not important. What's important is the on rotation. It's none of it is word association because the patient's not going to say, "I bet I have A, B, or C." Like you just you have to be able to reason through it. But the exam is right, like. Oh, the comma shaped bacteria. I bet it's no, like you just have to be able to like reason through it, right? And that's one of the most frustrating things about medicine is that I'm spending so much energy on a skill that is immediately obsolete once I get through that exam.
Yeah.
It is useless to us on the far side of the exam, but it's critical until you get there. And
I
it's
would say
so
that
frustrating.
it seems to me that this part of your education is sort of like a familiarization,
Mm-hmm.
right? Like, yeah, you're
Let's hope
supposed to do really well in exams,
Well,
but
no.
really when the rubber meets the road, you're out in clinics and you're seeing patients and you're sort of learning what Jeff is talking about. And then you're like, oh, I've heard of this before. This rings a bell or whatever. And then you can go look it up and then your attending says you're wrong and
Mm-hmm. Makes you cry in the
makes you cry.
bathroom.
No, they don't.
Yeah, I just think I feel like the word association for this point in our education, it's sort of like taking the place of like an Anki because it's just how to remember it. It's not really like, oh, so this is me reasoning through or this is replacing me trying to reason through things. It's okay, how am I going to make sure that I like know what that word is so that when I see it, I can like associate it with something. And for some people that's Anki, for some people that's whatever else. But for us, it's
Yapping.
somebody said it out loud. And so I need to put it in there.
Yeah.
And,
Keep
and,
it
it,
there.
and it works, and you need it right now. And that's one of the reasons why Anki works so well is because the MCAT and the steps and all of the in-house exams that you're taking right now, a lot of them are very heavily word association.
Yeah.
Like you'll get, I don't know, probably 40% just on the ability to put this word with that word,
Mhm.
right? You don't have to know anything else. And that's really helpful. But it's also, like, unfortunately not what we get to do out in
Right.
the real world. And so...
Well, Kim and I were talking about yesterday, like the point of these exams right now, the point of us learning these things is not so that we know it for rotations or know it for residency for med students. It's so that it's easier for us to relearn
Yeah.
when we encounter it
Yeah.
in the clinical space.
Yeah,
so
yeah,
it's
I
not
think
like
that's
we're
what I
learning
mean.
this stuff right now. It's not like we're learning these word associations so that we can diagnose a patient when we're face to face with them. It's so that we can learn it easier.
That's
once
what
we're
I
actually on
feel
the
like that's what
wards.
I mean when I
That's
say
exactly
that.
what you mean. Yeah. Mhm.
Yeah.
I will accept that, and I can appreciate that. Again, I've gone through that, so I've kind of seen
Right,
that for
we're
myself,
not there,
right?
so
Yeah.
Yeah. So I mean, N of one, but like, yeah, I've kind of lived that experience. So I can agree with that. But I also recognize that for accreditation purposes, medical schools teach to the exam, right? They have
Yeah.
to, because if students aren't passing their exams, they can't be doctors, and so they're not going to be accredited. So I felt very much so that like when I'm getting onto these step 1 and step 2, I'm like, oh yeah, it's because they talked about the Maltese cross, which is, they didn't tell me why there was a Maltese cross, but there's a Maltese cross, and I didn't know on histo that's what it looks like, and I'm like, okay.
I do have a question, Jeff.
It's about
since
Maltese
you...
crosses, please. Don't.
No, it's not. I don't even know what that is.
It's what a red blood cell will look like. It'll look like it has a Maltese cross on it, and it's because it has an intracellular parasite usually, and I don't know necessarily the biomechanics. It doesn't matter. Go on.
He's ready for the exam.
Yeah, I think
Just from that. See, that's all you need. If you can get that far, you can get the rest of the way.
Jeff can package up his brain
Yeah.
for you.
I was going to ask you though, with word association and like illness script type things, like if you have a patient coming in with like these cardinal symptoms for a certain disease, like they might not explicitly say it, but like the obvious one is like a patient with left or right lower quadrant pain. Like they might not say like, oh, my right lower quadrant is sore, but like the physical exam findings that kind of give you that word association, like point you in that direction.
And I can appreciate that. And that makes perfect sense in the context of the patient, right? But if then I'm going to talk to my attending, do I remember if it's McBurney sign or a Rosving sign or the SOAS sign, or the SOAS sign was pretty straightforward, but like all of these old white dudes that I don't remember, which sign is it? Even if I do remember, I say it to my attending is like, I don't know what that is.
Yeah.
Tell me where you
It's
put
like
them.
when you do tactile freminous.
Yeah. It's like, I don't know the word association. I know the algorithm, but I'm not going to remember these things, right?
Yeah.
But then I'll go and take my test and they're like, oh, it's a positive
right.
McBurney sign, and I'm like, I don't remember what that is because I just spent a year just treating the patient, not remembering some old dead guy's name. You know?
Yeah, that makes sense.
So where are we on this situation here?
I'm feeling heavily vibes based, but
Vibes
the
based.
order in
we're
which you
going,
guys
like,
study
vibes
feels
this direction.
spreadsheet.
Vibes down. I think towards the middle
Yeah.
on the X,
I'd give it a middle, yeah.
but more towards the right.
More towards
It
the
sounds very spreadsheet compared to what I do. I'm not kidding. I'm like flipping through random pages and like reading 2 bullets and then moving to the next thing. And it's very not spreadsheet. It's hot mess for sure when I do it.
So somewhere,
Yeah, I'd go with something like that.
Yeah,
Yeah, I think so.
shall we pick?
I
Maybe
trust Annie.
that one.
She
Down,
knows.
right
That-
there.
down. Yeah,
That
Right
one.
there?
Yeah, that one
Yep.
felt good.
All right,
Feels
I'm gonna select it, and then we'll reveal the answer.
Hopefully this is right.
Oh, not even close.
Okay,
You
I have
definitely
an
feel like you're much
explanation.
more evidence based, huh?
Okay, so upon reflection, I understand.
Upon reflection.
However, I think it's more. So I think it's more evidence based than you all picked, because what we're spewing. I mean, it's the correct content. Like, it's not like we're just in. It's not that. I feel like the spreadsheet hot mess axis is like jumping around like random stuff.
What I do.
But what we're saying, it's evidence based. It's not like, oh, I just feel like, yeah, it's sort of similar to like that. No, but like
Gotcha.
trying to like actually repeat,
You're having real conversations about the content.
which I guess
get
like,
it.
I don't know.
See,
This is
I'm
very much up to interpretation.
Yeah.
Oh, for sure.
I feel like I interpret it as like what I'm studying is completely vibes based. I'm like, oh, that for some reason I feel like I should look at that page.
Yeah.
Like that's kind of how I feel.
I feel like
As
I
opposed to
get what
like,
you're saying,
as opposed to
Kim.
like Anki, where it's like, oh, you missed these questions, you should look at these
Yes.
questions. But
Yeah.
but just before the exam, you're just
I'm like, yeah, I feel like I might recognize that one. I'm not going to look at it again. I'm going to go to this other random thing. And it's like, he mentioned that 3 times. I feel like I might want
Right.
to look at that.
Right.
Yeah.
I
Or like we went through
probably-
all the pathology, like small group cases this morning, because the liaison committee
I did that
said,
as well.
oh,
That's
if it's in the
evidence.
pathology cases, like it probably is important. So like it's a little bit evidence based.
Little
High
bit.
yield.
High yield.
Everything is high yield.
yeah, it turns
I
out when you
hate that
highlight
word.
everything,
Yeah.
it's all the same.
It's really
Nothing's
hard.
highlighted,
It's
you
almost
know?
like it's
Also,
more
nothing's high
information
yield, by
than-
the way.
Yeah.
That's what I'm learning.
Pro tip. Everything's high yield.
Everything and nothing is high yield.
Yeah, that's
Nothing is
accurate.
higher yield than anything else.
No, yeah.
The problem is that what is high yield for tests are the exceptions,
Yes.
and then what is
Yeah.
high yield in real life are obviously
I
not
know.
the exceptions.
That's
right?
so frustrating because they teach us all this stuff and it's like, okay, yeah, I get that I need to know that like random obsolete thing. And I know that I'm going to learn all the stuff you see every day when I'm actually there. But like, I'd rather just learn what's common. And
It
then,
really
like,
frustrated me how much time during I think it's the first semester they spent on PKU,
yes.
and then to find
Oh
out
my
that these are
gosh.
the only 2 children in the state that have it. I'm like, I want to empathize with the family, and I
Yes.
appreciate the mass side of this, right? The
Mhm.
ability to understand the system
Mm-hmm.
and how it's affecting these rare diseases, but also you have just shown me that I'm never going to
Yeah.
treat this patient. Like,
yeah.
there are 2 in the entire state, right? So that was
Yeah.
maybe not the best use of my MOHD time,
Mhm.
right?
And I totally agree. But then on the flip side of it, it's like, yeah, but you won't ever forget PKU again. but I'm not gonna like. That's never gonna be on my differential ever. I'm never gonna be like, nope.
Word
I'm
association
strong.
is musty, though.
Yeah.
I can tell you that. They smell musty.
They do smell
oh my
musty.
God, I forgot about that.
Yeah,
I don't even know that.
they've got a very
So-
interesting scent.
Yeah.
Okay.
Well, I appreciate now that you've explained it. I understand what you're saying. Yeah.
Yeah.
Should we try
You guys are
another?
a lot more put together than I am.
Yeah,
That's
let's
what
do
I'm
another one.
gathering from this.
I think
so
we're
we're
perceived
not.
to be. I don't really think that's really.
We try. We
I think
try.
I'm
Thumbs
not
up.
perceived to be. So
But note that the Java house location is very important because it would be so much more chaotic. I could not study in the learning communities before an exam.
No.
I think I would actually
Too much.
have a stroke.
Yeah, too
Oh,
much
yeah.
going on. In
I
there
can't.
before
I
Too many
agree.
people
There's
talking
too
about
many
what's-
people talking after exams. There's way too many people talking. Like I just need.
I don't want to
to
know what everyone else knows that I don't.
Yeah.
Yes.
I
It's too
can
late.
hear
Stresses you
after
out.
exams.
You
It's
sit
too
in the
late for me
comfy
to
chairs,
learn.
or do you sit at the tables in Java House?
We sit at the tables,
Tables.
far away. in the
Spreadsheet
corner.
vibe.
Mhm.
All right, that's
I probably
that's
would
more
have been-
spreadsheet.
Consistency also like lowers anxiety. Like we do
Yeah.
the same thing
Right,
every time.
yeah.
We know what to expect. Like
Yes.
yes.
Well, I think that's
Probably-
why they say like I learned in psychology like back in the day like go I don't know, study in the room that you'll be taking the exam. Do you
Yeah.
remember hearing about this?
Mhm.
Yes, it works.
I
Nick?
have one. I've been thinking.
Yeah,
Go.
okay.
She's
Let's
ready.
go.
Woo.
Okay.
Preparation.
Yes.
A rare
Spreadsheet.
commodity on this show. All right.
I think I'm gonna do meal prep, and
okay.
I think I'm gonna do for the vibes overbooked to off grid
Mhm.
and dumpster fire to vision board.
All right. Come visit.
While she's doing her thing,
Away.
I probably would have studied a lot better for exams if I had had a study buddy.
Yeah.
I would have appreciated that. But for the things that I did to my spreadsheet approach was, I took notes during all of the lectures on my iPad. And then I turned that into a PDF.
Mhm.
And then I recopied the things that were most important smaller. And then the day before the exam, I might recopy it one more, just the high yield stuff,
Mhm.
like the charts, right?
That's like, yeah.
Yeah.
That's kind of what we do.
Just the rewriting it really helps like solidify those charts. So that in my head, I can be like, okay, I know that obstructive lung disease causes
Yeah.
the blood pressure to do this or that, right? That was helpful. Also, just so that y'all know, this next month isn't necessarily the funnest month. It's certainly better than first semester.
Mhm.
Next semester, though, is a lot of fun.
I was gonna ask
I
you
really
because
hope
I'm
so.
so
but some
excited.
somebody
for
said
MOHD4
that about
and
this
Keystones.
semester and they
Oh,
lied.
Well, I
I
mean-
heard the exact opposite about MOHD3. I heard that it
I
was the
didn't hear
bane of
anything
everybody's
about
existence.
MOHD3.
Last semester, I heard you guys it's gonna be so much better. You're not gonna be in the anatomy lab
No.
7 hours a week.
I would go
You're
straight
right
back
about
to
that.
Piz.
I
I
mean,
would prefer
This
that
was
every
so
day.
much
I
better.
personally think that every semester got a little bit better, but everybody agrees that the last semester of the 3 is the better.
I have
was
heard
best.
that. Okay.
Yeah, no,
If
I
that's
heard.
consensus. I'm happy with.
I
Yeah,
heard the
yeah.
word like I heard like it's really hard having anatomy and like when you move from foundations in MOHD1 like it's a pretty big like ramp up and stuff, and it's also like everybody's adjusting the first semester. But I heard like everything about this semester. Like neuro is really hard, but it's really rewarding. Like
Mhm.
Cipla just teaches it
Mhm.
so well. But so I heard like that was really difficult.
I didn't think neuro was hard, but I took his advice really quickly, which was
Yes.
draw.
Yes.
He's
If
really.
you draw, it's
Yeah.
straightforward.
He tells you exactly what you need to do.
He is like the
Yeah.
to
best
succeed.
How are you-
instructor ever. Like the
Mhm.
best
Yeah.
teacher I've
Yeah.
ever had.
I learned so much in such a short period of time. It was really hard content,
yeah.
but
Yeah.
it's really easy to learn.
I
Yeah.
still hate
Teaches it well.
immuno.
If you-
Immuno still makes me angry. I just hate immuno so much.
Yeah.
I had a question today that I got wrong, and I was like, I don't care.
It's immuno. Don't
Yeah.
care.
Next.
Nobody needs an immune system. Not every single patient that I'm ever going to see
Like
has
the
an immune
basis of
system.
every disease.
Yeah.
Look, I know that they have an immune system, but why do I need to know CD88 versus CD44?
Know your
I'm
B
like,
cell markers, Jeff.
so freaking many.
Oh my god.
It's going to come up. Word
I
association.
get the interleukins mixed up all the time.
Yeah.
I hate immunity.
My toxic trait is like I read something, but I don't like comprehend something. So it'll be like a list of cell markers. And I'm like, oh, yeah, that makes perfect sense. And I could not tell you a single cell marker.
I feel
that
like that's
just
how I
read.
would be too.
Oh,
you
yeah.
know? Yeah.
It's bad.
Until it's
I-
written on the whiteboard, it's not in my brain.
Yeah.
Yeah.
It's the cell pathways that get me mad. Like, I'm going to be honest with you. Probably 75 to 95% of the time, I'm just going to guess Jack stat and move on with my
Yeah.
life because I don't know.
Tyrosine kinase.
Yeah. Is it
always
camp? I don't
something.
know. Maybe.
Yeah.
Who cares?
Cyclic
Jack
AMP
stat.
is
Let's
in
go.
everything. Just put that.
Yeah.
I have a preface.
Yeah.
tell us the story.
Well, I actually have a story about this week, but I'll tell you after you guys guess. But I love to cook. I love to cook pre-med school, pre-PA school. But now I just cherish the days that I get to go to the dining hall and use my free meal swipes.
Yes. Love it.
So that's my preface for this.
Okay.
You guys have free meals?
Yeah, you can sign
You
up.
can sign up
Swipes.
through like the dining hall. You get like 14
All
free
like the
swipes.
leftover swipes that the freshman meal plan people don't use at the end of the year. It goes into like a bank and you can apply for them.
That's
Yeah.
nuts.
You got to do it.
I mean, I lived at Firo. I had free food every day, but if I didn't, this would have been fantastic.
Mm-hmm.
Yeah, I need to use my swipes. I might need to go like every single day next week.
I will go with you.
I'll go.
Okay, perfect. Not
Tips.
meal prepping next week.
Tips for Iowa survival that you can use, listeners.
Yes.
Yeah.
It is a little bit triggering though, I have to say, walking back to Hillcrest as we are rather young.
Elderly.
No, well, young here, but it was only a year ago.
Oh, yeah.
We were part of that crowd, which is a little bit, so that's a little bit traumatizing. You kind of
Yeah.
have to get over that, and then it's really
See, I feel elderly which I'm not obviously, but I do feel elderly when I go to the dining halls because I'm like,
well, yeah, and then we sit down and
after
we're like,
you
oh my
turn
gosh.
20, you really can pick out the people who haven't turned 20
Yeah.
yet. I'm like,
I'm gonna be
I'm in
honest.
the midst of children and I am a child.
I'm
So
not even
confusing.
from Iowa, right? But like whenever I've gone with my friends, they're like, "Oh, we're gonna go out drinking this Friday." I'm like, "Okay, whatever." I don't drink, so it's not really that interesting. But
Mhm.
I walk over there, and I just feel like everybody on that side of the river is 15.
Children.
Yeah.
Oh,
I'm like,
100%.
Yeah.
There's no
Yes.
way that all of you are old enough to drink. This doesn't. I don't believe you.
Well,
but,
it's because
I
they
mean,
are
maybe.
children.
Yeah, they're
Mainly.
children.
But it's so weird because a year ago,
Now look,
I
this
felt like,
is our core listener demographic. I feel like so. You know.
Okay.
well, it was
core
us a
listener
year ago, so
demographic.
we're
I
like,
have gray in my beard,
cherish
so
cherish your
I'm old.
youth.
yeah.
Core listener
That's what I
demographic.
would
That's
say.
all I have to say.
That's what I would
Yep.
say. Live
Yeah.
it. Live it up.
No,
Live it
100.
up.
No, that's why it's sad because then we go over there and we're like, that used to be
You
us.
remember that?
And look
then
at
we
us now.
Sound like we're at
Yep.
the nursing
They
home
look so
talking
happy.
about
Yeah.
17
Yes.
years ago, reminiscing.
But then those people, like how we were a couple years ago, are literally would give anything to be in the
I
spot we are right now. So
know.
it's like really confusing.
I have that realization like all the time. Like sometimes it hits me again. Like you're here,
It's
you're
weird.
doing it. You've been doing it for almost a year.
Mhm.
Like it just goes so fast, and it's so hard to cherish it when it is like so busy and there's so much on your plate.
All right. So where are we at here on this grid of meal prep, access vision board to dumpster fire to vision board, and overbooked to off grid?
I'm going with that. If I could do this over time, there might be a slowly downtrend
Oh,
through
for
the
sure.
semesters.
So you mean you might start
Wait, what's the zero axis?
Yeah, what's
Overbooked?
good and bad here?
so overbooked and dumpster fire, off grid and vision board. See what I'm saying?
Is off grid like never gonna happen?
I think, like in my mind, overbooked versus off grid is like overbooked is like it's like scheduled out perfectly,
Okay.
Mhm.
and then off grid is like they don't even have a calendar. Like you haven't seen them in a month.
Okay,
you know,
okay.
like what's going on?
Okay, so I kind of feel like it's closer to overbooked, but not really close.
Okay.
Just like a little bit. And then definitely leaning towards dumpster fire.
Yeah. See, I think in theory this would be a perfect like vision board overbooked top left corner there. In
If you're
practice,
doing it.
Day
If
one
you're
of the
doing it,
semester.
Yes,
right.
yes,
Day
In-
one of the
yes,
semester.
in
exactly.
practice, this turns into quite a dumpster fire.
I bet you have a vision board over your stove that just says like the immaculate green beans.
I
Like,
bought a cookbook. Ask me how many times it's been opened.
aspirational. Good for you.
I know. Well, shoot for the stars.
This
Here's
is
the
like
thing.
I would say that this is 90% of adult life.
I would
Just so you know, like I'm
This is what I have to look forward
55
to.
years old yesterday.
Oh, happy late birthday.
Thank you. I still feel as competent as I did when I was in my mid 20s. I don't know what's going on. Like some days I'm like, hey, you know what? I should probably investigate becoming more of an adult. And then,
Yeah, but that takes all the fun out of it.
I agree.
There's
If you can pretend like you still don't have responsibilities, do you really have responsibilities?
My worst days are when I'm like, I have to do some adult
Yeah.
shit,
Mm-hmm.
right?
I would say that it's probably less than 50% of the people that buy cookbooks who use cookbooks, right?
Yeah.
It's more of an aesthetic thing.
Yeah.
But I
for
will
me.
say that
Like I look like I'm
0%
really
of
good
the
at
people
cooking.
that buy, like 0% of the people who don't buy them use them, right? Like
Yeah.
So you have a better chance.
True.
See,
It's
there.
Like you're in the
Shoot for
game,
the
at least,
stars.
right? You got the
It'll
jersey.
be there.
You're on
I'll
the
be
field.
bored one day, and I'll use it.
Yeah.
You know, the
When I
thing
have
that's so
time,
funny
if I have
about this too is I feel like if it weren't for the fact that we do need to eat to live, this would be shifted so far to off grid. Like I know for me, I push it to the point where I'm like, okay, well, it's either you won't eat, you won't have food to eat, or you have to cook something so that you can eat this week. And then that's like the bare minimum, you know? But like, if I would say if this was an activity that wasn't necessary for survival, it's probably
That's
moving.
where the dining
it
hall
would
swipes
be.
come in.
Yeah.
True.
I will admit, I have indulged in a single slice of cheddar cheese for dinner before.
Well, I ate ice cream for
dinner.
dinner for 2 days last week. I ate ice cream for dinner.
Yeah, baby.
So when I was in preclinicals, I lived at Firo, and so I had meals for lunch and dinner. Otherwise, I wouldn't have survived. Before I got married, my wife laughed at me because she was helping me like clean out my fridge to move into the apartment together, right? And I had 1 can of cranberry sauce. She goes, "Where's the rest of your food?" And I'm like, "I don't know. I haven't hot food in like 6 months. Like it's just this cranberry sauce."
Eat out.
And then after the honeymoon, I finally ate that can of cranberry sauce. I was like,
Full
That's it.
circle.
"Yeah."
Was it
Okay.
good still? Or had it been in there for a hot
I had it for a while, but it was still good.
It was testing.
Yeah.
All right.
Yeah.
It's not like
I
it was
like
open.
It's just like sugar and
Courageous.
Yeah, it's literally
Yeah, it's so processed. It'll be fine.
It'll be
It's
fine.
canned. Nothing's getting in
Yeah,
there, right?
right.
I think that's the interesting thing about living in this time, which is, so I'm old enough to remember that, when my mom would make food for us children, she had to basically make it from scratch,
Yeah.
right? And now you can go and pick up essentially whatever you want already made.
Heat it up.
Yeah,
call it a
or
day.
like friggin' broccoli in a bag that you pop in a microwave and like 1 minute later it's like really such a different experience. So even like now when you're like meal prepping, I'm like, just throw the bag in the microwave.
Is it like
Well, that
I-
is
I know
meal
it's
prep.
not. I know it's not great for me, like the Hot Pocket, but it's already made.
I gotta say that, like, 100 years ago, they're like, first started getting cars, and they're like, oh, all of a sudden, it doesn't take me all day to go across town, right? I
Yeah.
can visit my sister more than once every 6 months.
Right.
And then we got washing machines. It's like, oh, it doesn't take all day to wash our clothes, and we just got addicted to convenience.
Yeah.
We just love it.
But I
And
also
I'm not going to complain. I'm the
It's
same.
insane.
I want convenience. I do not want to spend time on food. It's annoying. I want
Dining
to
hall.
do what I'm doing.
Yeah.
Yes.
Shout out
Plug
Hillcrest.
the swipes.
Yeah.
If I didn't get hungry, I wouldn't eat. Like, it's so annoying. Every time I'm hungry and I'm like, I get cranky. I'm like, oh, this is the worst thing. I'm gonna go eat a bowl of cereal, I guess. Ugh.
See, with how far science has come, why can't we figure out how to photosynthesize yet? Because that's something that I think I'd thoroughly enjoy.
You know why?
You'd look
I can
good. You'd look
answer
pretty
this
good
one.
in green.
I have an answer
I'm
for this
saying,
one.
give me a chloroplast. I'd love it.
Humans will be photosynthesizing probably about 100 years after people stop clutching their pearls about GMOs.
Yeah.
But we got to get to that point where people are comfortable with let's modify
Let's
other things and
Inject
then
a
let's
plant
modify
into
us.
me.
And
I want to be one with the world. I want to be greenery.
It's a crazy perspective.
we've had some knockdown drag out fights on this very podcast. Listeners, feel free to go back and find them about things like CRISPR and stuff, where I'm fully on board with let's just design our babies to have chloroplasts. I'm all for that. But other people are like, oh, we don't know the repercussions. I'm like, the repercussions are plant people. Let's go.
I don't know if I want to go. I don't know if I want to go like Jolly Green Giant or anything.
Yeah,
but
I
I
still
just want
wanna
to
be
be
under
able
6
to
foot.
absorb the
You just
energy
want,
from
like,
the
a
sun
solar
as
panel
food.
on your head. Is that
Yes,
where-
yeah,
okay.
but like
I feel like we have that quality right now. Like I go sit in that outside in the sun after the whole winter, and I'm pretty sure something's happening.
something happens at
There's
the
a-
molecular
it's
level
a
in my body.
It's some sort of magic. I don't know what's going on,
Mhm.
but I'm
Like, you definitely
reborn.
need
Cured.
sun
Cured.
to live, but also
Cooking
like,
like a rotisserie
you
chicken
also
out
have
there.
to eat
It'd be nice if it could also like
chicken,
fuel us.
Yeah.
No, I need sun.
Me too.
I need a
little
window.
vitamin D in your life.
Window's got to be open. I need
Mhm.
to see the outside world.
Okay.
Yeah.
Are we choosing
Anyways, back to
Yeah, let's choose that square right there.
right here?
Yeah, that
Yeah.
one feels right.
Uh-huh.
After talking about photosynthesis. Ooh, not even close.
Not very close.
I
There
mean,
was
the
s-
x-axis is
So I would
not
say
bad.
the x-axis, the overbooked versus off-grid, it is more towards overbooked, just like the Vibe Master, Annie. But yeah, it's at the opposite end of the vision board versus dumpster fire. So
I will say that my vision board isn't always carried out, but like in my free time, I like to look at Pinterest and look at all the wonderful things that I could cook if I had time.
Yeah.
But I don't. My story for this week is that these past few weeks have been rough for us all in MOHD3.
Yeah.
So Monday was a tough day. Monday scaries are very real. I
Super
thought
real.
the one thing I would do for myself on Monday is to go home and meal prep a bunch of really good food that's going to make me feel good. So if the rest of the week I feel horrible about school, at least I ate something good that makes me feel good. So I went to the
Self-care.
grocery store, was spending about an hour meal prepping, and I was like not doing well after studying with Kim. And not because of Kim, but just because of
Dang it, Kim.
just because of pregnancy.
She needed a break.
and ovarian cancer.
just to clear, Annie does not have ovarian cancer, nor is she pregnant. But
Okay. That
we're
was what we
learning
were
about
learning.
that
We
this
were
week.
learning about.
Good catch, Gabby.
It was like,
Yes.
neither of you look pregnant, but it's none of my business.
Maybe it's new.
Just for context.
We need some context here.
So I was cutting up the vegetables, whatever, heating up a pan on the stove. Gonna cook some steak on the stove, and I go. I don't know how long I was heating up the pan for. My brain was in another place, and I go and I pour some olive oil on the pan, up in flames. I set a grease fire.
Quite literally
fire.
dumpster fire.
Literally dumpster fire.
This reminds me of the first time I tried to do meal planning. Like I very nearly burned down the kitchen.
I'm a well-seasoned meal prepper, but this studying was just getting to my brain. So anyway, yeah, I didn't know what to do about the grease fire. It took me a few minutes. I was in
Not
shock.
water.
No, I didn't put water on
Okay,
it. I
good.
actually put a pan on it.
Smart girl.
Yeah.
Snuff it
I know
out.
what to do.
My stove is just has a little bit of black dust on it now. But
Look.
A legit
You know, that was
grease.
a
Are
low
you
of the
even
week.
cooking if your stove isn't on fire?
But do you know what? She really
No,
pushed through
technically not.
because you cooked.
Yeah.
did.
You
She
finished
did
making
cook.
your food.
Let her
I
cook.
did.
Let her
I
cook.
Was it delicious?
Let me cook. It was pretty good. It
Yeah.
was pretty good.
Did
yeah.
it have a nice smoky flavor?
It's called marinating, Dave.
I actually threw out the pan, then used a new pan, and then started.
You
threw the
started
pan
all
away?
over again. The pan was cooked. My house smelled like acid. I burned off all of like the protective.
The Kevlar, or
chemicals
what's it
on that
called?
pan.
It's not Kevlar. The,
Teflon,
non-stick
yeah,
Teflon.
the non-stick
That's what it
pan.
is.
But that's where you get all those delicious microplastics.
That's
I mean,
right.
Yeah.
Exactly. That's what I want.
Maybe you will get chloroplasts.
Anyway, that was the low of my week. So then studying the rest of the week felt kind of hard, but not as hard as putting a grease fire up in my
As
kitchen.
Jeff likes to say, it's all uphill from here.
It is all up
Right.
here.
Mm-hmm.
The view is better at the top.
The view is.
I feel
yeah.
like you could count this as an accomplishment because you literally fought a fire in your house.
I'm a firefighter.
She's a
You can literally
firefighter.
put that-
Yeah.
She
Put that on
is
your CV.
First responder
resilience in the flesh.
For sure. No, this is absolutely what happens when on the rare occasions when I'm like, I'm gonna be Dave the cooker. And then I'll go. I did do something with ChatGPT last night, which was I took photos of my cabinets and said, figure out what to make for dinner, and it's come up with something.
Oh my
What'd it
gosh, no
say?
way.
Let's see if I can find.
I
it.
forgot that
Like you
can
took
do that.
pictures
Yeah,
of
things
the
like that.
food in
I
your
took
cabinet?
pictures
Here's
of
what I
food
have.
in my cabinet, my
gave
pantry,
you a recipe?
my spice cabinet, and my freezer.
I need to start doing this for like leftovers.
Yeah.
Like, how can I combine this into a not disgusting meal?
So it came up with.
And not waste
It
food.
depends on how strong that not disgusting part needs to be. Like,
So we're gonna. I mean, we're
Depends how
gonna see.
hungry I
We're
am.
gonna see what happens when I make this. But spiced chickpea and broccoli stir bowl.
that doesn't
Oh
sound
no,
bad.
that'll be
Good.
good.
Yeah.
I'm a big.
I
Are
got
you gonna
fan.
roast the
Canned
chickpeas?
I've got some frozen broccoli. I've got some rice from frozen rice from Trader Joe's. Got a bunch of spices. Throw them in a pan.
That'll be good.
Yum.
You should
I'm-
roast the chickpeas. I know it's a little bit of an
Oh.
extra
Or you have an air
step,
fryer, just throw them in
but
there.
yeah, if you like
Olive oil?
drain them, put some olive oil and some spices on them, they get like crunchy. It's nice on like a salad. I bet it'd be good in a bowl.
Okay. So my criteria was, throw it in a pan and
Hands
be done
off.
with it.
Right.
But
Pan plus
I could live with that.
one
We
pan in
we
the
do a
stove.
lot of roasting at our house because it's throw it on a cookie sheet and be done.
Yeah.
with it.
Right.
My wife
the
does a
same
lot of
thing.
roasting to
I
me. so-
love. Oh.
Yeah.
My see what we do in our house for we don't meal prep. That's not who we are as people. But we do have a spreadsheet. My wife.
How are you? How is that not you as a
Yeah.
person, but you have a spreadsheet?
Meaning I'm not going to make food on Monday planning out my week. So what I do is what I do is I open the fridge, and if there's food, I eat it. I don't care how old it is. It's going inside of me, and then I'm done. Right? I ate
wish it
quinoa
was
that was
like
made,
that.
I don't know, a week ago. Who
See,
knows?
this is
Don't
why,
you
this
learn
is why you should
something
be
about
more-
why you're not supposed to store grains like that? There's a micro.
It's the reheating.
on the
It's
rice.
it's
Okay.
the series bacteria is what you're concerned
Yeah.
about, and it's reheating the rice. But I don't reheat it. I just eat it cold, and then I'm happy.
Oh,
This is why you should
safe.
be
Yeah,
more
so big deal.
grateful for your immune system.
Yeah.
Exactly. See?
Yeah, I'm getting iron. Like I lived in Guatemala when I was younger, like ironclad. Like nothing's going. Like it's just fine. I had mild hepatitis once from a parasite, but that's not
Just one.
You're here. You live
We're
to see
here,
the light.
right?
Yeah,
he looks
Jeff
great,
has so
he's
many
fine.
good stories.
But so my wife has this thing where she can't eat the same food forever, but she'll like hyperfixate for like a week, and then she's like, I can't see it for another 6 months.
Yeah.
Yep.
And I'm like, all right,
That's
like
a girl thing.
problem.
Yeah.
It's a
I'm
girl
like,
thing.
yeah, I could eat the exact same meal every day for the rest of my life, and I wouldn't mind at all. 2 years where I ate oatmeal for breakfast every single day, and I ate beans for dinner every single day, and then
Just
came home
beans?
and I thought, yeah, they were black beans.
he says,
What?
he says
Tortillas.
completely justifying
I
his
lived in
position.
Guatemala. That's the preface.
Okay,
here. I lived in
context
Guatemala.
matters.
Beans, tortillas. That was it,
Gotcha.
right?
Oh, tortilla.
And I
got fuzz on
I
your
came home
mustache,
and I
dude.
thought I really want
Yeah, hey,
beans.
well, you have fuzz on your mustache, I feel like. I should tell you as a friend. Yeah,
Thank
there
you.
you go.
But so for my wife, I have a spreadsheet of maybe 50 meals, and we rank them based off of how much she wants them not to be in her house, right? So like a 10 is I want to eat this week, and a 1
Logically.
is ask me again in a year, but not before, right? And that's how we kind of keep track of, well, what do we want to eat this week? All right, well, let's go down the list and let's see what you're in the mood for, and then that's what we'll make. And then I'll just eat leftovers whenever she's tired of the food, because
How
Do you guys,
frequently do you re-rank this list?
every time a food is brought up, it gets re-ranked. So if I say,
This is
hey,
smart.
do you want to
No,
do
that's
these,
actually a
these
really
roasted
good
pepper
idea.
meal that I really like to make? So I like to like roast the peppers and tomatoes and onions,
Yeah.
and then I'll make quinoa on the stove, and we'll mix those together. It's delicious, right? Like, do you want to do this? She's like, I really don't want to see that for a year. Okay, moving it down. Or
Perfect.
you know what? Ask me again in 2 weeks. All right, we'll make it an 8, right?
Well, that's
Sounds like a
smart.
foolproof system.
Yeah, that's a good idea.
It works really well.
smart.
It's
And it
kind of trial
fixes
and error.
the
We've been married for
I don't know.
several years, so it's taken some time to like figure out what works for both of us. We've also lived apart for a good chunk of that because we were in medical schools in different states. So like coming back together and trying to figure out what works for both of us is a whole thing too.
In my house, we are entirely vibes based about meals. I would say that if we cook for the family 3 nights a week, we're in decent shape. And then the other nights are what, for some reason, I can't remember, we call potpourri in our house, which basically means you're on your own.
Mhm.
Make it happen.
See, that's what I don't get about this meal prep thing. Is like, don't you have leftovers? Isn't that just meal prep? Don't I just call leftovers meal prep?
No.
That's how I
We
meal
do not
prep.
have
That's
meal.
how
We
I
do
meal
not
prep.
have leftovers in our
I-
house, and I feel like at some point this might happen to you when your children are voracious.
That's my dream is to not have leftovers in my house and not waste food.
yeah.
That's my dream.
I
hate leftovers.
there
That's
is
my
a-
thing.
there
Is
is a
I do
point-
not waste food.
There is a point at which you're looking at that leftover food that's in your fridge that's a week old, and you're like, "How
Could one
am I
of
going
my
to roll the
children
dice?
eat this?
Am I going to roll the dice?"
No,
Jeff's
Roll the
rolling
dice.
the
Said
dice.
You don't want to be responsible.
that's going in the trash.
Jeff the Iron Gut is rolling the dice.
That's how I got the iron gut. If you're not willing to eat
Risk
Eggs
and
Benedict
reward.
that have been in your fridge for 10 days, don't talk to me about how you want to live without responsibilities.
I'm in
I'm
agreement.
just a girl. I can't.
You see,
eat
there's
things
only
like
the
that.
margin of error though for
It's-
life
it's like-
outside of medical school these days. I can't. I don't have time.
It's true. You don't want to get
It's-
sick.
It's
No.
like a couple of hours in the bathroom. You can study. You can do Anki.
You
I can't.
I
I
can't
take the
I
iPad
can't
and
there.
word associate across the
Well,
table at Java when I'm in the bathroom.
That's just your relationship needs to make it to the next step.
Technology.
That's all that
Yeah.
means.
We should
I would
sit in
say-
the
Stall
closer.
next to you. It's not that big a
Annie
deal.
gets
Yeah,
a call from
I would
Kim.
say I think
so
Grow up.
I'm gonna need you to come over.
We need to study, but I have to stay in the bathroom for a little bit longer.
We'll just yell through the door.
Yeah.
Yeah, you could just put her on speakerphone.
We could just
You're fine.
FaceTime. Oh my god.
It's called adaptability.
Okay.
Well, I feel like we've done a thing here today.
Mhm.
For whatever it's worth, listeners. Maybe I should have warned you to go look at the YouTube version of this so you could see what we're clicking on. But it's not that important, right? It's probably not that important.
No,
Yeah,
there's
no,
too
yeah.
many
Good time.
You
tangents.
described it pretty well. I feel like.
So that's our show. You guys, thanks for joining me today.
Thanks for
to have
having
a little
us.
Yeah,
fun.
it was so
It's really
fun.
fun.
I hope you'll come again.
Yes.
I love
The trio.
I love what I do.
The rhyming trio.
Yes.
I love love when a
Annie, and
group
Kim.
Yeah.
makes the decision to come forward and be on the show together.
Mhm.
You know, and I also love when people just come on the ones, but you know,
Jeff.
I think it's a lot of fun.
You're always welcome in the
He was
rhyming
including
squad,
you
Jeff.
in that.
Yeah,
Jeff rhymes
Jeff
too.
doesn't rhyme,
Yeah.
but Jeff and
Kim?
the Rhymers.
Jeffy.
Jeff in the rhymers.
Jeff and the Rhymers. I like that.
Jeffy, that works too. Jeffy, Kimberly, Gabby, Annie,
There we go.
Perfect.
Done.
Perfectly rhymed.
Davey, Audrey,
Thank you.
Audrey.
I was my growing up. I was Davey.
I like
so you're already-
Davey.
you're already in the
yeah.
group.
Welcome to the
Alrighty.
squad.
Yeah.
I want you to
New
know
squad
that
established.
as a Jeff or Jeffrey, it doesn't matter how many times I spell out my
Jeffrey
full name or
rhymes.
say Jeffrey. Everybody wants to call me Jeff, and I'm like, that's just
You're
who I am,
just
I
a
guess.
Jeff.
I'm just a Jeff.
Yeah.
Jeff is in the vibe for you.
So thanks for chilling with me today. And what kind of dope would I be if I didn't thank you, Shortcuts, for making this part of your week? If you're new here and you like what you heard today, follow the show wherever fine podcasts are available. If you can't find it wherever you get your podcasts, I want to know about it. Let me know. Shortcoat.com/tell us. The show is made possible by a generous donation from Harvard College Medicine student government and ongoing support from the Writing and Humanities program. Our music is by Dr. Box and Catmosphere. I'm Dave Etler saying don't let the bastards get you down. Talk to you in 1 week. Hi, Shortcoats. Look, life in medical education, life in America, life in the world is often difficult. And I often wish I could help. All I have is this podcast, but in my wildest dreams, you have the support you need to lead a life of your choosing. You deserve to be happy, healthy, and successful in whatever ways you define those words. So if you need support because you've experienced racism, discrimination, harassment, mental health crises, I want you to be able to get the help that you need. And so I'm going to put some links in the show notes to some resources that you can use. But the bottom line is that for what it's worth, I see you. I know you're out there. I wish I could do more. Maybe I can in ways that I don't understand yet or know about. But I see you, and I'm glad you're here, and other people are too. This Short Code podcast is a proud member of the MedEd Media Network. Inspiration, information, and guidance on your journey to medical school and beyond at mededmedia.com.